All right, well, let's talk about Paxlovid. Paxlovid is Pfizer's new oral antiviral that they have applied for an emergency use authorization with the FDA. I think they've already submitted it. This was their press release on Friday, November 5th, and they're talking about their interim analysis. So before we talk about their interim analysis and the results of their clinical trial, let's talk about what Paxlovid is. So Paxlovid is a combination of their drug that they developed called PF07321332 and Retonavir. So to understand what this thing is, we kind of need to understand a little bit about the biology of the virus. So here's a paper. I'll link this paper if you want to read it. But this is figure one, talks about the coronavirus virion and life cycle. So here's the coronavirus, and these are the little spike proteins, the little pink dumbbell looking things, and they will attach to the ACE2 receptor. When they attach to the ACE2 receptor, they go into the cell. All right, so the monoclonal antibody um, cocktails that are being used, like Regeneron medicines, they target the virus here. The monoclonal antibodies will bind the spike proteins and it will keep the virus from attaching to the cell and infecting new cells. So basically, the antibodies stop the process here, or it impedes the process here. It doesn't stop it completely, but it just slows it down enough so that the your body can clear out the rest of it. Then after it gets uh, taken into the cells, the viral envelope uncoats and releases the mRNA. The mRNA then gets transcribed by our own cells machinery and makes a bunch of proteins. So it makes four structural proteins, either the nucleocapsid, the M protein, the E protein, and the spike protein, and then it makes two large polyproteins. So basically, the virus, instead of making single proteins, it makes this large string, and inside the large string is a protease. A protease is an enzyme, and you can think of an enzyme like a little machine, basically. It's a little machine that cuts other proteins. And so what it does is this protease cuts itself off of the chain, and then it proceeds to chop up the polyprotein into functional proteins. So if this protease doesn't work, it can't go to the next step, which is where it starts making replicas of its own genome. And where it makes replicas of its own genome, that's where the other antivirals that we've heard about, molnupiravir and remdesivir, those are nucleoside analogs, and they kind of interfere with the synthesis and replication of the viral genome. So what this new drug from Pfizer, this thing with the long name, or Paxlovid, what it does is it targets this protease, the protease that chops up the polyprotein. This has been a recognized target from pretty early on. This is a paper in Nature from April of 2020, and it says that the structure of the MPRO. So here we will go down to where they talk about what this thing is. Right here, the SARS-CoV-2 genome comprises about 30,000 nucleotides. It's a very large genome for a virus. The replicase gene encodes two overlapping polyproteins. So these are the big proteins. They're not a single protein like we make them. The viruses make them as a single long chain, and they chop them up later, that are required for viral replication and transcription. The functional polypeptides are released from the polyproteins by extensive proteolytic processing, predominantly by the M-pro protease, also known as the C3L protease. This M-pro protease digests the polyprotein at least 11 conserved sites, so it chops it up at least 11 times. Anyways, this protease, or these molecular scissors, are very important for the SARS-CoV-2 life cycle. It cannot function without it. So people realized, hey, if we can stop this protease, that would be great. And because this protease is not like any of the proteases that we have, so we also have proteases, but this M-pro protease, or this C3 3CL protease, does not look like any of our proteases. So it seems like it's a target that we can make a drug that inhibits that, and it won't affect any of our proteases. It'll just affect that protease, which is what we want. We want specificity in a drug. There's another paper that talks about some compounds that certain labs found out that could stop this, and this was published back in April. Now Pfizer these guys are like from universities, Columbia University, Cambridge, Columbia. Now Pfizer evidently was working on it for a long time, and they didn't tell anyone about it because obviously they're a company and they don't want to let everyone know what they found until they're ready to release it as a drug. So they published this very recently, November 2nd, 2021. And it says an oral SARS-CoV-2 M-Pro inhibitor clinical candidate for the treatment of COVID-19. So here it is. They named it this. I'm sure they named it this because they screened like 7 million molecules through high throughput screening, and they found out that this is the one that worked the best. Anyways, we won't go through this. It's very technical. But basically, they screened a bunch of molecules and they found out that this one inhibits it. And they combined it with ritonavir. Ritonavir is a really old drug. And it was this is also a protease inhibitor. But this one targets the HIV protease. And the HIV protease does the exact same thing that the coronavirus protease does. It chops up its own polyproteins to make it work. But this is a generic drug. It's on the World Health Organization of Essential Medications. But the reason that they use it in this case is they add a little bit to this as a cocktail because, not because it's a protease, not because this acts as a protease inhibitor for the coronavirus, but because it inhibits the P450 enzymes in our liver, and those are the things that break down other proteases. So if you give it along in combination with this protease sticks around longer in our body. All right, so that's how it works. This is a protease inhibitor that inhibits the protease that SARS-CoV-2 needs to chop up its polyprotein so that it's a functional virus and it can replicate itself. And this ritonavir is just an inhibitor of one of our liver enzymes so that it just sticks around a little longer. Okay, so let's talk about their interim analysis. What they did is they had a clinical trial with about 1,200 people, so 600 in each group. And what they did is they treated them within 3 days of having symptoms. So treating them pretty early. They had to be within 3 days of 3 days of starting symptoms. And their endpoint was either hospitalization or death. And they purposely picked people who are at high risk of progressing to severe illness. So that means, either they were obese, had diabetes, had some cardiopulmonary issues, or they're old. So they didn't have like young, healthy people in this thing because most young, healthy people are not going to get hospitalized or die. So in order to show an effect, you want to give it to a high-risk population. And that's what they did. And when people who took Paxlovid, less than 1% of them either were hospitalized or died. So basically, 3 were hospitalized, no deaths. Compared to 7% were hospitalized or died. So 27 were hospitalized and 7 died. So basically, when you run the numbers, that's 89% efficient, which is quite impressive. Then they go in here, the primary analysis. So they have 1,200 people enrolled, but the interim analysis was only in about 600 of them. The safety data, they showed that adverse effects were about the same between the two. So 19% had adverse effects at Paxlovid and 21% had adverse effects with placebo, which means that's just kind of the background level of adverse effects. And then fewer serious events, 2% versus 6%. So placebo had more serious events. And this is them talking about what this thing is. It's a SARS-CoV-2 protease inhibitor antiviral therapy. All right, so they are going to, they've submitted for emergency use authorization. This is probably going to get approved. And in terms of the safety profile of the things, this is probably like most other drugs. They're going to have some non-specific effects. Like if you look at ritonavir, it has some liver effects. Um, Nausea, vomiting, loss of appetite, diarrhea, some kind of neuropathy. These are the kinds of things that you're going to see on most prescription drugs you have. Simvastatin, um, high blood pressure medications, ACE2 inhibitors, all those things. They're going to have like these nausea, vomiting, loss of appetite, GI symptoms. So I suspect that this is a small molecule protease inhibitor. It's going to have similar profiles. People have been taking protease inhibitors for HIV for a long time. Long-term use does lead to a lot of side effects, liver damage, and lipodystrophy. But if you take it for a few days for SARS-CoV-2 infection, if you're a high-risk person, seems like a pretty good drug, actually. Um, when they release their final phase 3 results, I will definitely be looking over that. I'm also waiting for the principal trial to finish up their ivermectin things. Ivermectin's been a thing that people have been very interested in. There's lots of small studies showing that it's effective. The large Together trial showed that it's not effective, but then people were like, maybe they didn't give it early enough or the dosage was not right. So the principal trial is running an ivermectin trial, but I haven't heard anything from them since like this summer. Anyway, we're going to keep an eye out for that because I definitely want to find out what the principal trial found out about ivermectin. But in terms of this Paxlovid, seems like a very promising drug. I think we're getting a lot of promising therapies, and I think that's very important because we need to protect our vulnerable people. And so far we have molnupiravir, we have the monoclonal antibodies. Probably remdesivir is also useful if you give it early enough, but the problem with that is the IV, so it's a little bit harder to use. So now that we're getting some oral medications, so molnupiravir was the first one. This Paxlovid is the second one. Um, as long as these become cost effective, that should be really good. I've heard that the United States has pre-ordered 100 million doses of this Paxlovid, so Pfizer's doing pretty well with this. All right. Well, if you have any questions, comment below, and thanks for watching.